Hi, I'm Helen Taylor from Professional Medical Careers Institute, and as you know, we have a COVID-19 outbreak in the state of California, and because of that, and because of the emergency declarations, we, for the first time, are allowed to do online training with vocational nursing students, which has never been allowed and never done before. So we are doing it for the first time today here at PMCI. We have our theory and our clinical instructors here, and they are monitoring students. And it's different. It's a lot different. But we're pretty excited about what we have to offer our nursing students, and we hope that we will continue to be able to train our students. We also hope that we will be able to get our clinical sites back very soon so they can have that hands-on training that they really need. So we have here today our instructors, Erica, who teaches clinical in level 1, and Kim, who teaches clinical as well. So we'll go ahead and hear from them, and we'll ask them a few questions. Okay, so we have over here our instructor Erica, who's teaching our level 1 students. I think this is one of their last days of clinical. And so just tell us what you think of going online for the first time with students.
I definitely think that it's overwhelming because we have a ton of information that we want to get out to students, but the programs that we are utilizing are fantastic. They're allowing the students to really dive deep into head-to-toe assessments, really dive into, you know, what we're looking for as far as their clinical. So I think it's awesome. I think it's a really great learning experience for them. It's a learning experience for us as well, but we're all up to the challenge and we're really excited about it.
Okay, great. All right. So we have here another one of our great clinical instructors, Kim Washburn, who's been teaching at PMCI for a long time and was actually a graduate of our vocational nursing program and is a fine example of moving up the career ladder. She's now a registered nurse and she's been teaching for us for several years now. So Kim, why don't you talk about what your students are doing today and how this compares to actual clinical and how it will help them.
Well, first and foremost, I would really want you to understand that we want the clinical experience, obviously, for all of our students. It's very important to have didactic, hands-on, real-life experiences. So I was a little skeptical at first with the online program, but once we started to implement it as the instructors and learning about it, we came to find out that in actuality, it's as close as you could possibly get. The animations and the assessments and the programs that are available for these students now work very, very well with their learning experience as to what they get hands-on. For me personally, as an instructor, my ratio is 1 to 10 students. They have a program that they can utilize and have an instructor right there with them, monitoring them for if they have any sort of questions, and also these tutorials that are available to them as they go through the process with their head-to-toe assessment. So I'm super thrilled to be a part of this process, to learn about what's available out there online for us. Compared to probably what we had 20 years ago to now, this is incredible. And I wish that I had had something like this going through the educational process. So I'm super excited to be a part of this with my students. We're all coming together for the first time and moving through this new movement because there's so many changes going on today, but we're able to keep up with it, and I'm super excited to be a part of it.
Okay, great. And then just one more question. Do you think this would also help them once they go back to the optimal of having hands-on in the clinical sites? Do you think this program would help them?
Yes, I do, because this program, I've taken a look at it. It specifically goes into every little detailed area. Sometimes as a student, you don't even have any idea as to what it is that you actually are missing until you see a scenario come up real life. The scenarios that are implemented here in this program, there's so many of them, so there's quite a variety for them to be able to learn and grow from. So I think they're going to be able to adapt really well going back onto the floor with more knowledge because of having that one-on-one training online.
Okay, thank you very much, Kim.
Thank you.
Okay. Okay, this is Cheryl Gloss, RN. She has actually been a PMCI instructor since we started the program 12 years ago. And she has moved up the career ladders, now working on her master's in nursing. And she's been one of our main theory instructors for quite some time. And with her technological ability, she was able to get PMCI online to meet the objectives that our students have in vocational nursing training here in California. So Cheryl, what were some of the challenges that you faced taking PMCI online?
Well, going from classroom setting to the online setting was a little bit difficult, but most of the community colleges in the area have moved to a platform called Canvas. And since many of the students were familiar with this platform, that was the platform we decided to use as we were transitioning the students from the actual physical setting to the online setting. What's nice is the students are able to turn in all their coursework online. They're able to take all their tests online. And with the NCLEX, students have to test online or via the computer on all their tests. And so going from a written test to a computer test actually prepares the student a little bit better for the actual NCLEX test. So it has been a great transition, and a lot of our clinical we now have that we're able to give digital clinical has helped the students learn assessment techniques in a different way and allows them to practice on a simulation before they even have to go out and work or practice or on actual patients.
Okay, great. Just one more question. What programs are you using and what do you like about each?
Okay, so I already mentioned Canvas, and that's the platform that has all the PowerPoints on it. It has the homework on it. You're able to turn on the homework on that. It has videos on it. It has additional resources there, our study guides on there, and all our quizzes are on there. So that's Canvas. We're also using our clinical-based simulation, which is called Shadow Health. And on Shadow Health, they're actually doing assessments on a digital patient, and it takes you from a head-to-toe assessment and really gets the students comfortable with those assessment techniques. So it's a great program. It also has additional focused exams. So it has a cardiac one, a respiratory one, and also abdominal concept lab where they're actually practicing listening to normal versus abnormal sounds, which allows them to fine-tune these assessment skills. So those are the two we're using right now.
Well, thank you. I hope this has been helpful to you. I know it's a great challenge to all of us who are teaching vocational nursing students, especially because forever we have not been able to do online training, so this is a first for all of us. So we're very excited, and I'd like to thank all of my faculty who've worked very hard, Cheryl and Erica and Kim and all of the others who have worked very hard to bring our students this training so that they can finish their program on time and go out into the workforce and be licensed vocational nurses. Thank you very much. And from all of us at PMCI, say goodbye.
Bye.
Bye.